Hi, my name is Debbie, and you may have seen some of my posts in some of the groups related to TMJ joint surgeries, or if you're just reading this on my YouTube channel, then you may not have seen any of my posts, but you may have been led here by another route. Anyway, I'm here because I want to start sharing my story and helping people and doing kind of like outreach to people who have had TMJ joint surgeries. So this first video, I really want to just focus on telling a little bit about when I had my surgery and what happened with the surgery. And then I want to make a second introductory video about that will focus more on what's going on with me right now and like what happened recently to me. And I wanted to make this first video with like nothing on my face, no makeup, no tape on my face, no TMJ joint wraps or anything like that. So you can see my face, what I look like, all that kind of stuff, because I can't stay like this for very long. I'm gonna have to put something on my head, and the second video I will likely have a wrap and tape on my face. So here's what I look like without anything, and I have some redness right here that is actually from kinesio tape, which I use to tape up my jaw because of what's going on, which I will explain later. But anyway, so in 2017 I had a bilateral TMJ joint replacement and Lafort 1 surgery, which is an advancement of your upper jaw, for those that are unfamiliar with that. I had that surgery all in one with Dr. Larry Walford in Dallas, Texas. Now, what led me to that point was, I think I was, I was 46 when I had that surgery. So for many years prior to that, starting around teenager, adolescence, 14, 15, something like that. I don't really remember when it started, but I had headaches, which I didn't really pinpoint were actually TMJ. It was actually TMJ pain. I just thought it was a headache. So for a long time that went on, and then I had, in my 30s, I had a job where I was a sales rep, and I talked all day long, constantly, and I would be in so much pain. And it got really busy at my work, and I was just like, I had like 5 or 10 minutes in between customers at this busy time, and I just would like put my head on the desk and cry in between appointments and then get myself together and start again. And I just thought to myself, this is ridiculous. This is crazy. There's something wrong with me, and I need to find out what it is. So at that point, I'll try not to go into too much detail. But basically that started my journey into figuring out what is this. So I started like really focusing on like where's my pain, and I realized it was coming from my joints. And then I went on this journey of going to all these like TMJ dentists and quote unquote self-proclaimed TMJ specialists, and I had splint after splint after splint, or if you call them orthotics, they're the same thing. And in fact, none of them helped. None of them helped at all. It made my pain worse. So I just, kept rejecting them and refused to wear them because it made my pain worse. So then I had 2 arthroplasties on my left joint. So the left joint is really what I want to talk about because that's where a lot of my issues are. My left joint was always the worst. And I always had this sensation like my whole, now I know what the terms are, but this is your condyle right here, which is basically your mandibular portion of the jawbone. So there's the mandibular portion, of the TMJ joint, sorry. So there's the condyle is the bottom part of the TMJ joint, and the glenoid fossa is the top part of the TMJ joint. So I just always felt like my condyle was kind of like sagging down a little bit. Like it was like my muscles were kind of like holding up the whole lower portion of the left side of my jaw into the socket, whereas this side never felt like that. And anybody who has a normal joint or doesn't have this laxity that I'm referring to, you don't have to hold your joint in place. It's just there. And I struggled with that and I'm still struggling with it, with finding somebody who understands that, because the majority of people who are dealing with TMJ surgical issues or things that lead to TMJ surgeries, the majority of those people don't have that issue. Most of them have some kind of issue where the bone is deteriorating, or the disc is displacing, and I had all those issues, but they were not as bad as a lot of you may have that issue yourself. You may be watching this right now and have that same issue. Like if you have ICR, or some kind of arthritis, rheumatoid arthritis, or anything that like eats away at your joints. I haven't found that I have anything like that. Maybe that hasn't been uncovered yet, but as of now, I don't have any conditions that have been called that, or have tested positive for things like that. So I'm not saying I don't, but I just haven't uncovered that yet. So anyway, I had in 2013, I had my first surgery on my left joint. It was an arthroplasty with Dr. I think his name was Edward Kirk, or Dr. Kirk. He used to be in Charlotte, but unfortunately, I'm sad to say he passed away. So that was my first surgery. And then in 2015, I had my second joint surgery, which was with Dr. Scott Boulding. I had another arthroplasty with him. And that one was like the MyTech anchor surgery. I don't even remember what they do in that, but they basically try to anchor the disc. That's really all I know. That did not prove successful in that. And actually, before I had that surgery, I was on a track to go ahead and have the joint replacement in 2015. I had already seen Dr. Walford. I had consulted with him in 2014. And I was put in braces, and I was going to have the surgery, and then at the last minute, or at some point soon, I decided not to do it, and I had that arthroplasty with Dr. Boulding, and I really regret that. So I had that surgery and 2015, and then after that, I just started pursuing joint replacement surgery after that, because I just couldn't live with it anymore. So after, so I had my surgery then, my joint replacement surgery. I had both sides done. And both sides did hurt. And the reason I could have just had this side done, and I could have not had the Lefort, but I did have a recessed jaw. Both my upper and lower jaw were pretty recessed my whole life. And so I decided to do all of it. I decided to have this joint replaced, and have my jaw moved forward. So the upper jaw was moved forward with the Lefort. It was cut here underneath my lip and moved forward, I think 6 millimeters or something like that. And then the lower jaw, when you have a joint replacement, they don't have to do a BSSO. They can use the joint replacement to extend your jaw, and they don't have to break your jaw here. Well, they break it to put the joints in, but that's it. So, so that's what I had done. And then right after surgery, about 3 weeks after my surgery, I started having like a lot more, well, I was already very swollen, but I had more swelling on this side, and things started to look like I might have an infection. So, and just to let you know, in case you're wondering what made me suspect that, was I started to have some liquids coming out of my joint. And so called my surgeon immediately. And first we tried some antibiotics locally. I don't live in Texas where Dr. Walford is, so we had to, try a little bit of conservative things first. So we did antibiotics, and then we didn't really wait that long. It was maybe a couple of days, and he would just immediately said, "You need to come here." So even though I had just come from there, I had spent like 2 weeks probably in Texas, or maybe it was 10 days, something like that. I had to go back to Texas. And at the time, I was married, and I'm not married anymore, but at the time, my husband was a self-employed businessman, excuse me, and he did like HVAC work. So he had to provide for us. So he could not come. He had already just taken 10 days off of work to come with me for my surgery. And at the time, well, I still have a daughter, but she was a lot younger then. So we had a small child, and he had to provide for us. So very scarily, I flew by myself back to Texas, and my head was so swollen that I couldn't hear anything. So I was going through airports like completely deaf. Like, I really got a feel for what it's like for a deaf person, because I couldn't hear not one thing, and it was really scary. So I went back there, and immediately he just told me to check into the hospital. So that's what I did. I checked into the hospital, and I got, they put me on some really hard antibiotics right away. And the idea was just for him to observe me. So he had me on antibiotics, and he was coming in, Dr. Walford was coming in and checking on me. And, you know, he explained to me that we're going to give it a few days, and he was going to, they're doing blood work on me the whole time. Like, they kept coming in and collecting my blood and sending it to the lab. And about a week of that, of me sitting in the hospital by myself, my family had not, you know, come at that point yet, because we didn't know what was going to happen. We thought maybe it would be okay and I would just go back home. So it wasn't okay. After about a week, he decided it's not getting better, so we have to open the joint back up and clean it out. Call it a debridement. Debridement. I forgot how you say it. Debridement. So that's what we did. At the second week, then we had surgery. He opened the joint back up. He actually did the incision at the same point where he went in to do the joint replacement. And I'll try and see if I can zoom in on that, if you can see. Sorry about my bruises from the tape, but I don't know if you saw that or not. But anyway, it's right there. So you can't, it's hard to see it, but maybe you can. But that is where my scar is from the joint replacement, and then he also cut me here. So I don't know if you can see it on this side. It's a lot lighter on this side because he didn't have to go in on this side twice. Anyway, if you're looking at Dr. Walford as a surgeon, I mean, that is not from Dr. Walford. That's from my tape, but like, my scars look really good. So we went back in, cleaned it out, and then a week later I went home, and then I had to have a PICC line, which is like a port where they can basically, you know, insert. It's an IV that stays on you, and then you can just put IV antibiotics in you, and that's what I had to do. I had to have home IV antibiotics that I had to do myself. So for 5 weeks I was on that, and that I had a couple of complications during that. I developed a blood clot from the PICC line, which can happen, and a blood clot is very serious. So I had to go to the hospital for like one day, like checked in, and they had to make sure it didn't spread to my lungs or anything. And then I had to be on blood thinners for a little while, and then I don't remember at what point that happened versus the next thing that happened. I know this was last because it was right at the end of the antibiotics. I had the antibiotics. I had been on them for about 5 weeks, and I was supposed to be on them for 6 weeks. So I only had 1 more week left. But I developed a very serious reaction, allergic reaction, or just a reaction to the antibiotics. It was called cefepime, is the antibiotic that I was on. And I got hives, and my face started swelling, and I had to go to the hospital for that. I mean, it was all over my body. So we immediately stopped the antibiotics, and since I made it to 5 weeks, that was fine. So I had to go. Now, I had been already seeing, since I got home from this, I had an infectious disease doctor now. I had my very own infectious disease doctor. So he was monitoring me, and then, you know, he said, you're going to be seeing me for the rest of your life, or you're going to be seeing an infectious disease doctor for the rest of your life, because people who have a prosthetic joint in their body, if they get an infection, any prosthetic joint in their body, hips, knees, whatever. Then you have to be, if you get an infection with a prosthetic, then you have to be on antibiotics for the rest of your life, which I did not know that. So I was not happy about that, because I really think that you can build up a tolerance. I don't think that's definitely a known fact. You can build up a tolerance to antibiotics, and then they don't work anymore. And I'm already allergic to like 4 different antibiotics. So that was not good news. So basically, after 6 months of that, he had weaned me down to like a really low amount of antibiotic, like 1 pill, I think, of Keflex, like, I don't know, 350 or 500 milligrams, something like that. But I had weaned down to just 1 pill a day. And after a while, I was just kind of like on my own, stopped taking that. And then the next time I went to see him, I told him, and he got mad at me, but he's like, well, we'll just monitor you. And then after a while, I never developed another infection. Everything was fine. And he said, okay, then I guess you're fine. And also, I just want to say that when I told Dr. Walford what the infectious disease doctor said, that I would have to take antibiotics for the rest of my life, he didn't agree with that. He didn't think that the culture of the, the bacteria, he didn't think it was the same as other infections in the body. So anyway, I don't take antibiotics now for that anymore. So I do want to go back to my second arthroplasty, where I referenced, I wish I didn't have that done. And you probably have noticed by this point of me talking that my right eyebrow is the only one that works. And my left eye doesn't blink all the way. So I have nerve damage. So the facial nerve is right around your TMJ joint, for those who don't know. And in my second arthroplasty is when that nerve got damaged. So it never came back. I had a lot of like physical therapy, and I also did work with a plastic surgeon who does facial balancing. And if you have any nerve damage in your face from a TMJ surgery, I highly recommend seeing somebody like this. So what he did was, he filmed me on camera, and he had me make facial expressions so he could see exactly what muscles were paralyzed. If you look at my smile, you can see that, well, you can't see it, but I'll point it out to you. It's very hard to notice unless I point it out. There was a lot more nerve damage before I was seeing this guy. But this muscle here, actually, I think this might have been from the joint surgery, the joint replacement surgery. And it's not really damaged. It's just my lip doesn't go down very well when I smile, like right here. And then up here, this was definitely from the arthroplasty. So like the whole left side of my face was affected by the arthroplasty. So this doesn't, like, I can't make that go up very high right there, like that corner. So that's kind of what happened with my nerve damage. And also it has resulted in, when I smile, like this muscle, I think it's called the platysmus or something like that. Like this pops out a lot, because it's basically when you have nerve damage, like the muscles that do work overcompensate for the muscles that aren't working. So like that is working overtime to help me smile or do my facial expressions. And I'm really sad about that, because I'm a very expressive person. But it is what it is. It's been 7 years, whatever. So, but anyway, I do want to talk about this plastic surgeon. So what he did for me was, he's not just a plastic surgeon. He actually, I looked up, somebody referred me to him. I was going to have a weight put in my eyelid by oculoplastic surgeon at Duke. And he recommended I not do that, because he said, he can't guarantee that my eyes are going to look symmetrical. And he said mine wasn't as bad as some people. Like, I can still close my eyes like this. It's just when I blink, it doesn't go down all the way. So he recommended I not do that. And he referred me to this plastic surgeon. And so I didn't really know much about this guy plastic surgeon. I didn't know what he operated on. Like, usually plastic surgeons specialize in a body part. Well, I found out later, like a year after I'd been seeing him, that he really only does like breast augmentations. But he's somehow, I didn't ask him, but somehow he's developed this interest in facial reanimation is the term that they use. So he really does works with a lot of people to do facial reanimation, like people who have Bell's palsy, or people like me. So I imagine most of his, or like if you have a stroke and you lose control of your muscles. So what he did was he filmed me, as I said, talking and like doing certain expressions where he could see the muscles that were paralyzed. And he injected Botox into my certain muscles of my face that are the opposing muscles to those, I guess. And so basically by paralyzing a working muscle, you help strengthen the one that isn't working. So it's not to say that he's bringing back, you know, a nerve that's completely dead. He couldn't do that, but he could help if the nerve was still working. Then that would help like retrain the muscles to get going. So it did help a lot. My face was a lot deader, I guess you could say. Like, I had a lot less ability to move my face. And most of the time when people see me talking they might notice my eye not blinking and my eyebrow, but a lot of times people tell me they didn't even notice. Anytime I go to the emergency room, they always notice. They think I'm having a stroke. But I'm always quick to tell them, I'm not having a stroke. This is from TMJ joint surgery. Anyway, I wanted to talk about that because a lot of people comment in our groups about, you know, nerve damage and things like that. Like, even if you have nerve damage, you can still have a wonderful life. I'm here to tell you, like, after a while, it didn't bother me anymore. And I do still consider doing the weight in my eyelid, because I know some people have had like really successful, surgeries on that. And so I might do it at some point, but for right now, I'm not doing it. So that's pretty much like my surgery and the things that happened from the surgery and my other surgeries. In the next video, I want to talk about like what happened to me this year. I comment a lot in our TMJ groups because I do want to help people and like, you know, tell about my experience and be encouraging. I'm still pro TMJ I'm still pro TMJ joint replacement, because up until April of this year, 2024, I was great. I still had some minor things that bothered me. I'm not talking about the nerve damage, but I had some other minor pain issues, and that's what led me to seek out help with those. It had been long enough where I was like, I've got this little residual pain issue that I want to see if I can get taken care of. If anything would help, I would be happy, because even though I had a huge reduction in pain after my joint replacement, I still was in pain. And I, just to talk about pain versus function, I'd talk about that really quick. My issue was not function. I know a lot of people in this realm of talking about joint replacement and doctors say, don't have surgery for pain, have it for function. So I didn't really have any function issues. I could eat whatever I wanted, and I could open like 40 plus millimeters. And so I was a little bit of a controversial case. Excuse me. And when I talked in the very beginning about this like sagging issue with my joint, I really didn't know if that would be fixed when I had the joint replacement. And it was a lot better. Like, I still had like kind of like a little bit of a looser feeling, but it was so much better. And before the surgery, I felt this pain of like a sling. Like it felt like I had a sling of pain on me, like right here. And anytime that I did any activity, like walking, we used to go walking in the woods because we lived like out in the country. And like you have to look down when you're walking and in the woods like that. You know, you have to watch where you're stepping. And that just the act of like looking down would make my whole jaw and my head and my neck hurt like so, so bad. So it really, really impacted my life. And after the surgery, it was a lot better. I went back to having a great life after my surgery. So it wasn't until I sought out this help for this residual pain that things kind of went downhill. I will talk about that in the next video. I'm going to go put the tape on my face. And so when I come back, I will talk about that. And then just thanks for listening, and I'll see you soon. Thanks. Bye.